How quickly your body makes milk may not always match up with how quickly your baby consumes it. When possible, you'll want to save milk for later use. To do this, you can express your milk by hand, use a manual breast pump, or one that is electric or mechanical. There are many pumps available. They all work to remove milk from your breast. Each has a different fit and features. The key is to make sure the flange at the edge of the cup is a good fit for your breast. The edge of the cup needs to lie smoothly and fully in contact with your skin. The flange size may need to change throughout your breastfeeding experience, so make sure to frequently check its fit. When you're ready to begin, carefully wash your hands with soap and water. Or if this isn't available and your hands are not visibly dirty, a hand sanitizer solution of 60 to 80% rubbing alcohol. Make sure you have handy some breast milk storage bags or several clean food-grade containers with lids. Collect all your materials and move to a quiet place. Sit in a chair where you can reach everything. If you are expressing milk by hand, hold a clean storage container in one hand and place your clean nipple at the open end. When beginning hand expression, make a C shape with thumb and pointing finger. If looking at a clock, position thumb at 12 and pointing finger at 6, about a half an inch to 1 inch behind the areola. Start massaging with your fingers. Begin closer to the chest wall, moving toward your areola. Keeping the C in place, move toward the chest wall, then compress thumb and pointing finger, rolling toward the areola. Stop when your fingers are just behind the areola. Repeat this motion around the breast until you have filled a container or until your breast seems to stop releasing milk. Repeat this on the opposite side. If you are planning to use a manual pump, make sure that all the parts of the pump have been carefully cleaned and rinsed per the manufacturer's instructions. If you're using a mechanical pump, attach a clean storage container onto the pump. Fit the flange cup onto your breast, making sure that it surrounds but does not block any part of your nipple. Follow the manufacturer's instructions. Activate the pump. Continue until you have filled a container or until your breast seems to stop releasing milk. Repeat this on the opposite breast. Double pumping involves pumping from both breasts at the same time. It can be valuable for a new family. The pumping session may last 15 to 20 minutes, and for new moms it can be up to 30 minutes to completely empty the breast. Pump until the milk is no longer expressed. After pumping, clean all the parts of the pump. Use a large bowl, not the sink, to prevent transfer of germs. Use hot, soapy water and a bottle-type brush to clean every surface. Rinse carefully. If any part is moldy, do not use it. Replace it immediately. For extra germ removal, sanitize the pump or other feeding items daily, using one of these methods if the manufacturer's directions allow. Clean in the top rack of the dishwasher using hot water and heated drying cycle or sanitize setting. Boil in water for 5 minutes after cleaning. Steam in a microwave or plug-in steam system after washing. As with any food, breast milk can spoil and make your baby sick. To store your breast milk, use breast milk storage bags or food-grade containers with tight-fitting lids. Avoid using any plastic with the recycle number 7. These contain a chemical called BPA, which can leach into your breast milk. For convenience, use small feeding bottles with caps. Later, when you're ready to feed, simply attach a nipple to the bottle and warm the contents. If your milk is freshly expressed, it's best to refrigerate it immediately for use within 4 days. If this is not possible, freshly expressed milk can be stored on a countertop at room temperature for up to 4 hours. If you freeze it, you should try to use it within 6 months. If you're planning to freeze milk, be sure to use freezer-safe bottles. When using thawed milk, you can store it in the refrigerator for up to a day or on the countertop for up to 2 hours. Never refreeze human milk after it has been thawed. If you have milk left over after feeding, use it within 2 hours. Otherwise, throw it away. Accurately label each container of pumped milk. On every container, note the date and time that you pumped the milk. If you are taking the milk out of the house, to daycare for example, label it with your child's name. Store milk in small amounts, 2 to 4 ounces, to avoid wasting it. Leave a little empty space at the top of the container to allow for expansion of the milk during freezing. When storing it in the refrigerator or freezer, place the containers near the back, not in the door. If you don't plan on using it within 4 days, freeze it as soon as you put it in the container. When using milk from storage, select the oldest first. Thaw and warm the milk by placing the container in lukewarm water. Never use the microwave to warm milk. Overheating the milk can destroy the nutrients it contains and burn your baby's mouth. Sometimes the fat can separate out from the rest of the milk. Swirl the milk in its container until it is mixed together. Test the temperature of the milk by placing a few drops on your wrist. It may feel warm, but should never feel hot.